What is the definition of a good doctor? I know that you are a great surgeon, Dr. Yafi. What do you think is, how can you define a good surgeon?
I think, you are a great surgeon, so that's obviously a question that you can answer as well, but I think different people have different perceptions. For me, a good surgeon, I think the most important definition of a good surgeon is the person who does the right surgery on the right patient. The second one, I think, is a surgeon who knows his limitations. As a surgeon who will not do a surgery that he or she is comfortable doing. And three is a surgeon who is always trying to improve himself by learning new techniques and new strategies and how to improve their outcomes. But I think as long as you're doing what's right for the patient, I think that's what makes a good surgeon. And I spend a lot of time with my patients talking to them about what the right options for them. Sometimes patients don't know what's right for them and they want something, but you have to try to convince them that that might not be the right thing for you.
So, why attending meeting like this, or not? You just didn't attend. I know you organized a meeting like this. Why does the meeting like this is important to us?
Meetings like this are great because this is where you get to, first of all, learn. Because we always have to learn to improve. So you learn new techniques. You learn from people like yourself, authorities like, for example, Dr. Shea, Dr. Wilson, other people who are very knowledgeable. You improve your surgical skills, your clinical skills. You're able to also present what you have done, your own research, so that maybe you can help advance the field and teach others. And also it's very important because we get to network with other people who are in our field, and I think it's very important for all of us who do the same thing, for us to become friends and colleagues so that we can all have really open channels of communication to improve ourselves.
So with your current practice, where do you want to go? What's the goal of your practice right now?
My goal of my practice is to become the Sean Park of California. The goal of my practice is just to continue growing my practice, becoming busier. I'm already quite busy, but continue improving, becoming a better surgeon, improving my skills, improving my outcomes, learning new techniques. And this is why we come to meetings like this. And just, to continue serving my community where I live, as long as I can.
When you set your goal, what's the priority? Top three priorities of yours?
My first priority is my family and being a good parent and a good husband and a good son to my parents and a good brother to my sister. That's my first priority. My second priority is to continue doing the work that I'm doing towards my patients, whether it's clinical, whether it's procedural, whether it's surgical and all that stuff. And the third is to continue to grow within societies, the academic work that I do with publications, sitting on society committees, growing, helping improve the field and things. But these would probably be the sequence of the priorities: family, patient, and then academics.
So do you ever thought about this like this way? Well, whether the private guy or the academic guy will serve the patient better?
Not at all. I think this is a misconception that is often thought that if you go to an academic doctor, he will be a better doctor, he or she will be a better doctor or serve patients better. That is not true at all. There are a lot of academic doctors who don't improve, who are not at meetings, who are not, their intentions and their goals are different. And then you have private practice physicians like yourself who are here at meetings teaching others. Learning. You, Dr. Steve Wilson, are good examples of private practice guys who have advanced the field more than many more academic people. I think at the end of the day, it's a person to person.
Do you have friends who pursue the oncology in urology? Do you find any differences among different specialties, like in terms of their satisfaction to their job?
Yeah, I have a lot of friends. Some of my best friends are oncologists or minimally invasive surgeons or laparoscopists or robotic surgeons. I think oncologists, I think general urologists, I think endourologists tend to be a little bit more stressed, I find. They have more emergencies, they have more complications for patients. So that potentially brings in a little bit more stress. They stay longer hours operating. We as men's health specialists, we're basically office hours. You go in a certain time and you leave at a certain time. It's pretty close in general. You will get the occasional complication that you have to take care of, but our quality of life is much easier than a lot of these other people. on the flip side of it is, because we do elective surgery, when we have a complication, it's a big deal. When you're doing a surgery on someone with very advanced bad cancer and they have a complication, it's expected. On our end, patients are coming in because they want us to improve their quality of life. So if you have a complication, it's disastrous for the patient, but it's also takes a toll on you. It has a lot of stress. You lose sleep. You're anxious about it. So it has its own things. But I think in general, we have better probably quality of life of other compared to other specialties.
Throughout my residency, I was able to have a lot of oncology patients. But even though we did the cystectomy with all the neobladder surgeries, like a really, really difficult one, 12, 13 hours of surgeries, we saved their life. We were able to save their incontinence. We had about 600 to 700 cases of the cancer patients. Only 1 or 2 patients were saying thanks, doc, for saving my life. Other than that, most of them didn't say anything, and some of them did say that, it's so miserable to live a life like this. So, do you think this may affect affect our perceive toward the job, like specialties?
Of course. I mean, the happier every time I walk into a room and I have a patient or a happy partner, that makes my day. If I go to a patient, I put a penile implant in them, and him and his partner come in and they're incredibly happy and they're delighted, and they get candies for the office or whatever, that makes me obviously incredibly happy. Same thing if I have an infertile couple and I help them get pregnant. Patient's happiness immediately correlates to physician-surgeon happiness, but also patient discontent immediately correlates to physician discontent. So you have to stay balanced. You can't get too excited, and you can get too down on yourself. You have to stay even keeled to a certain extent.